What's up, y'all, and welcome to another episode of In the Wild. I'm Rayshawn, and today we have a little treat for you because, in case you didn't know, once upon a time, there was a little boy named Rayshawn who wanted to be a nurse, and he was so fascinated with the field of nursing and all the cool things that it entailed in high school. But as some of y'all who've long watched this show know, that I switched my major, and that led to what I'm currently doing now. But I still love the field of nursing, and today we are talking to some amazing faculty members. First up, we have Dr. Jennifer Broxton, who is the program director for the CNL program, in which I'll tell you more about that in a second when she joins us. And we have Dr. Colleen Walters, who is the program director for the DNP program here. Both are nursing degrees. The first one is for your master's, and the second one is for your doctorate, in case you were wondering, because the field of nursing has really grown well beyond bedside care. And I think a lot of people think that it's only bedside care when it comes to being a nurse, but they are researchers, educators, innovators, practitioners, so on and so forth. And I'm excited to talk with these ladies and to share with you guys about all of the career opportunities that you have if you decide to become a nurse or advance your education in nursing. So I hope you're ready, Jag Nation, because here we go. Welcome, Dr. Broxton, to In the Wild. We're so excited to talk to you a little bit. Can you start, I guess, just by telling us a little bit about your role and I guess a little bit about your background in nursing?
Yeah, so I'm a triple JAG. I absolutely love Augusta University and all of its programs. I graduated with my bachelor's in nursing in 2003. Got my master in nursing as a critical care clinical nurse specialist in 2008, and then went on to get my Doctorate of Nursing Practice in 2020. So after graduation, I went to work at Augusta University, a medical center in the trauma and surgical ICUs, and that's where the first 17 years of my career were as a staff nurse, charge nurse, clinical nurse specialist. Loved that, and did some teaching on the side with the college, and then in 2018 I just really felt called to teach at the academic level, and I joined the CNL program and took on different leadership positions, and then took over as a program director in 2022, and just absolutely love that program, and it's very special. It's a very unique program, and I'm just very proud of the impact that it's making in nursing. So
I love that, and I especially love that you're a triple JAG. So with that being said, what do you think has kept you here to being a triple JAG, but also spending so much time in your career here?
I'm a creature of habit, but no, I had such an awesome experience in my bachelor's degree. Was going through some personal issues that almost prevented me from finishing nursing school, and the faculty and just the support that I got helped me through that. And I just, I felt like I was at home at Augusta University. And then my master's degree was the same thing. I felt like I had hit this new level in nursing, just loved it, and enjoyed using those new skills. And then when they developed the DNP program and brought it to AU, I was like, I think I want to try that too. Just get a new skill set, and it's just, the faculty are amazing. So it's really easy to come home to Augusta University for additional education. So
I love that you said that, like it feels like home, because that's exactly how I felt when I was an undergraduate student, just here for undergraduate preview day. Like I just came here, and just the people here always made me feel at home, like this was the right decision. Mm-hmm. So I'm glad that you had that experience as well. And for those who are unfamiliar, like what is the clinical nurse leader program? Like what is that for, or who is that for, and how does it kind of fit into the scope of nursing?
Yeah, so the clinical nurse leader, CNL, is actually the first new nursing role that's been developed in over 40 years. So it's a really, a really interesting role, and it was developed because of these huge gaps in care that we've seen. All the research was kind of focusing on, we have all these nurses at the bedside, but there's still big gaps in care with coordination, kind of things falling through the cracks. And so it was developed not as a management role, but as a leadership role at the bedside, where nurses have additional training in evidence-based practice, research, quality improvement, care coordination, and they're actually coordinating care, evaluating plans of care that other nurses are doing at the bedside with patients, evaluating outcomes, and really trying to provide a more cohesive experience for patients.
Yeah, that makes sense, because I feel like a lot of people, when they think of nursing, they may only think of the bedside part of your role and not thinking about the research or the evidence base that you mentioned that goes into it.
Yeah. So again, the majority of CNLs do practice in hospital settings, but they are trained to practice in any setting. So that can be a community setting, that can be a clinic setting, that can be a research setting. So yeah, the possibilities are really endless for the role.
And how does, I guess, this program differ a little bit from maybe other advanced nursing degrees?
So the thing that's a little hard for people to understand, it is a master's degree because the requirement is that you have a bachelor's degree in anything that's non-nursing. So business, biology, health sciences. And then it's an accelerated direct entry program. So in 18 months, you get a master's degree and you're able to sit for the nursing licensure exam. What makes it different is that, again, you get those additional skills of research, evidence-based practice, the quality metrics and things like that. And I feel like it's a really great degree for those people that felt they'd missed the boat in nursing. So, those 2+2 students are like, oh, well, I've hit my junior year and now, I didn't get into the nursing program, so I'm going to move on. Or, for those people that are like, I've got this biology degree and it's not, I'm not really finding my niche and what I want to do, I missed the boat on nursing. This is perfect for all of those people because it gives you an opportunity to, whether it be later in life or, right after graduating with your bachelor's, you're like, hey, nursing's really calling me and I want to place in, And who wants to get 2 bachelor's degrees? If you have the opportunity to get a master's degree. And so, but the difference with that, it's not an advanced practice. So CNLs are called advanced generalists.
Okay.
So they're not advanced practice nurses. It's still a direct entry pre-licensure program. So they're starting off just like the BSN students as far as they are brand new graduate nurses learning how to be nurses. They just have additional skill sets that can help move them into leadership positions a lot faster.
Okay.
Yeah.
I love that because, as you mentioned, it does help those who may have a degree in anything that say, hey, maybe during undergrad, I didn't feel like it was my calling or I was intimidated for whatever reason, but now there's opportunity for me to get a master's degree and continue my education in nursing.
Mm-hmm. Yeah, and our students, what I love about the program too is the students, because they do come from various backgrounds and they have all different kinds of degrees, they bring just a really rich perspective and all of the experiences they've had, and I feel like they bring that into their nursing education journey, and it makes them just much stronger, more robust nurses. So it's really cool to see this transition as they progress through the program.
Have there been any majors that really surprised you at this point that have come into the program?
No, not really. I've really seen it all. Liberal arts, like I said, business, finance, bankers. We've even had attorneys.
Oh, wow.
Yeah, no, that's actually that. There we go. That was the one. Just had one of my favorite students just graduated this past year who was an attorney and, decided to become a nurse. So
that's really cool.
Yeah.
What is that like for you as the program director to see like you're getting students from all walks of life to come in and to be here at Augusta University?
Like I said, I think it's a great learning opportunity for all of us as faculty. As a program director, I still teach in the program too, and so again, I really rely on those our students and their perspectives, and we try to meet them where they are with those because they do come in with so much knowledge, but at the same time, not to just assume what they know, So it's an interesting flow of how things go in the program, but I think our graduates come out and from what they say and from what our clinical partners say, they really, like I said, they make really strong, excellent nurses. So
if you had to describe a student that would make a great fit for the CNL program, like what would that student look like?
Somebody who's passionate about nursing, somebody who is open-minded and flexible. Definitely with this program, they have to be resilient and have a lot of grit. It is an accelerated program, nursing school. I tell the students all the time, I say, this is like nursing school on steroids. I was like, get ready, put your roller skates on. It is an intense program, but I feel like we provide a lot of really good support. I do a lot of coaching with the students on my own when I meet with them about, just mental resilience and those things you're going to need throughout your nursing career. But I think, like I said, if they're resilient, they've got grit, and they're flexible, and they just want to learn, then I think that's the student I'm looking for. So.
That sounds good for anybody that's watching out there. If you feel like you fit in that description, go ahead and apply.
That's right. And we open August. In mid-August, the application cycle opens. So,
okay.
Yes.
So I guess just zooming out a little bit and talking just about the role of nurses and what that looks like in 2025, because we kind of talked a moment ago how it is more than just bedside. Mm-hmm. For those who might still be carrying those misconceptions about nursing, like, do you mind kind of talking about the opportunities just at large of what having a degree in nursing could entail for a career path?
Yeah, so it's such an exciting time to be a nurse. It's no longer the white cap, in the hospital and all of that anymore. I mean, we've been done with that for a long time. But bedside is not the only place. Medicine is moving towards primary care and holistic care and prevention. And so, yes, you can go in the hospital, and I mean, I loved being in the hospital for 17 years. It's wonderful. But there's community settings, there's research settings, and since COVID really did a number on healthcare and nursing, but it's opened great opportunities for research, not only for patient outcomes, but for nursing outcomes. Innovations in healthcare, we were talking about AI earlier. AI is becoming a big part of nurses' workflow and machine learning. And so there's opportunities for entrepreneurial people who want to be a nurse, and tons of nurses are starting their own companies using AI and, study opportunities. So there's, legislation, advocacy. There's just so many things you can do. And the great thing about nursing is that it's a career that grows with you, because you may decide you want to start in the hospital, and then a few years later you want to teach, or you want to go into advocacy, or you want to start your own business, and that career, nursing, it will grow with you. So I think it's the best career that you can have.
I love that, because, once upon a time there was a little boy named Rayshawn who wanted to be a nurse. Yeah, it's true. I came here and I took biology 1107, and then I learned that me and science, I'll always love science, but studying science and it just as a career, we weren't a good match. So I still just always, like, even in high school, like, I had worked to get my CNA, and I was like, before I came here, I was like, I just knew I was going to be a nurse. So I always have like a big respect for the work that y'all do, because it is very vast. Like you mentioned, like, you can go in so many different directions. And with saying that, when I guess you first got started, did you go into nursing knowing that you had so many opportunities, or was it kind of
I really didn't. And when I was in nursing school, I thought I wanted to do labor and delivery. Quickly figured that out. Did not want to do that. Did an internship in the trauma ICU and fell in love. I love adrenaline. I love the fast pace, just all the drama, as we call it, the trauma drama. And, I found my place. But again, that's the thing, is that, I think the great thing about nursing today, too, is that you're not stuck in one place. So, I mean, hospitals are hiring brand new nurses knowing that they can move around, and they need to move around. And so most facilities really do work with you. If you're not happy in a year, they try to move you to a place that is a better fit for you. So there's always lateral movement, no matter what area of nursing that you decide to go into. And
I guess this is, more of a faculty question now, for you putting on your faculty hat, but I guess how do you teach those things for those various settings and all the opportunities that a nurse might have coming through the program? Like, how do you capture all of that?
Well, I mean, I think we do a really good job of showing all the different specialties in the inpatient side, and we're still working on that community piece, but we do try to tailor our classes to give them clinical experiences where they can see different, community settings. My students just finished projects this past week, actually, where they did an actual, like, a summer-long intervention at Compass for Hope, and some of them did Hope House, some of them did like the Boys and Girls Club. So they get to see how nurses can fit into every aspect of their community. So, and then, I mean, obviously we prefer to have them do live experiences to get that information, but then we bring that into our classes too, bring in guest speakers and things like that. So, but I think just overall as the program, all of us have, most of the faculty have really different experiences and backgrounds. And so we showcase that and we share a lot of that about our own journeys so that our students can see that they can do whatever they want to do, type thing.
Now, I love that, that y'all are able to put them out in these like real life settings, like you said, the Boys and Girls Club, Hope House, and other places to have that real world experience. Because to me, being able to graduate, have your degree, but also say, hey, I've done these things, so I really have a good idea of how I want to make my impact now that I have my degree and licensed.
Yeah, exactly. Yes, and licensed, very important. Have that.
So what would you say for your program, because I love asking this question to people, if no barriers and you just had all the resources for CNL, you could get anything that you wanted, what would be some of the first couple of things on your list to get?
Housing,
providing,
okay. Housing. Our program is the only CNL, Model C CNL program in the state of Georgia, and there's only 22 in the country. And so a lot of our student body comes from all over the country. And so, but because it is a graduate program, they don't get all as much support as the undergraduate students do. So I would love to have, housing specific to our, like an immersive, like an academic community almost, where they can be immersed in different types of activities while they're going to school, and also have that socialization and stuff. So, and I would love an endless supply of faculty and supplies.
Of course. And I guess also thinking for the next couple of years, just in the field of nursing, what do you think is on the horizon that students might need to be aware of?
Always, again, with AI is becoming so much a part of our workflow, embracing that obviously, but I think also as faculty, we have to also really kind of hone back in on that personal side and really teaching our students that we can't depend on a piece of machine or a monitor, got to kind of get back to those basics of touching, caring, listening, those things that are really basic nursing, while also embracing the technology and things like that. So I feel like for us, it's, we do evaluate, course evaluation type things every year looking at that. So I think it's really listening to what our clinical partners are telling us, what they're seeing, but also re-engaging our graduates to kind of talk to them and ask them, what is it that, you needed from us that maybe you didn't get from our program. So.
And what would you say, just looking at the CNL program here, makes you the most proud?
The impact of our students. Just again, I just had a group of students who did an intervention at Hope House, and obviously I can't talk too much about it, but I mean, they really dug deep into the population that was served at that facility and really did some awesome advocacy work and education with the women there to help them as they navigate the healthcare system. They really went above and beyond. So when I see things like that, it really warms my heart. But our graduates, I have a graduate he's a CNO of a hospital now. We have, they're in big leadership positions, and just, again, just the impact, the butterfly effect. So, I mean, it just makes me so proud to see them. And I always tell them, please email me. I want to hear all the awesome things that you do. So that's my favorite part, is just them coming back to say, hey, I want a Daisy Award, or, I got this award, or whatever, that they've done, or I got my CCRN certification, So I don't know. I really find a lot of joy and pride in their accomplishments. So.
Oh, I love that. And I just know from our conversation so far, we've convinced some people to apply to the program. So where can they go to learn more about the program, how to apply, all that good stuff? Yeah, so if you go to the Augusta University website, you can just type in CNL, and there's a whole landing page that has all of the plan of care, the plan of study, the admission requirements, as well as the dates for when our admission cycle opens. So. Well, thank you so much, Dr. Broxton, for chatting with me. For everyone watching, I hope you're convinced to check out the CNL program, but stay tuned because we got some more conversation when we come back.
Stay connected and organized with My Augusta, the official app for Augusta University faculty, staff, and students. Customize your dashboard to view courses, emails, files, events, and more with easy-to-use widgets. Access personalized tools that give you access to other systems and apps at Augusta University. Pin your favorite pages and tools for quick access. Find exactly what you need: pages, tools, events, people, files, and posts with a simple search. Filter results to save time. Receive tailored alerts based on your profile and never miss important updates or events. Download and explore My Augusta today.
Welcome, Dr. Walters, to In the Wild. We're so excited to officially have you because before we had you live for our kickoff way back when, but now we have you in the studio, so welcome.
Thank you for having me.
So let's start with just your journey and why would you say you decided to pursue nursing, especially getting advanced degrees in nursing?
Yes, well, the abbreviated version is, as a mom, I have 4 children. I encountered healthcare professionals, and I was most impressed by the nursing care that I received. And I switched majors.
Oh, nice.
Yes, to becoming a nurse. And before completing my Bachelor's of Science in Nursing, I decided to continue on with my education. It was the dean at the time who kind of mentored and inspired me to become an educator specific to nursing. And so I continued straight into the Master's of Science in Nursing program. I was hired on as faculty, and I know that my passion for primary care, my journey did not end at being an educator, that I really still wanted to impact healthcare directly, although exponentially. Educators impact healthcare through all the students that they teach who go on to see many, many patients. So I applied for the Doctorate of Nursing Practice program here at Augusta University back in 2011-12, and I chose to be a family nurse practitioner so that I could be at the forefront of preventing disease and health promotion and keeping people healthy and out of the hospitals. So that's my journey, I think, seamlessly for 11 years, from my Bachelor's of Science in Nursing all the way to receiving my Doctor of Nursing degree and becoming a family nurse practitioner. Yeah.
I love that. And I guess what made you decide to go here for your DNP?
My Doctor of Nursing Practice, the DNP, yes. So I had a faculty in the undergrad program who mentored me, and she was just a brilliant faculty member, and she received her Doctor of Nursing Practice degree here at Augusta, and my Bachelor's of Science is at another USG, smaller school of nursing. But at that school, I was encouraged to apply for the DNP program at Augusta University because of the support that my faculty and mentor and friend had received when she was here. And she introduced me indirectly in a way to her faculty advisor who helped her complete her Doctor of Nursing Practice degree and a project that's aligned with the degree. She, Dr. Margaret Murphy, it was my predecessor actually. I'm in the role as the Doctor of Nursing Practice program director, and Dr. Murphy was program director. So
nice.
It's so full circle that, that support and mentorship that we received in our education, we inspire others to continue their education. We point them to programs like our own here at Augusta University that is supportive and will help students to complete their dream, right, of becoming whatever they want to in terms of their degree and in terms of the nurse practitioner tracks that we have. Yeah, we have lots of options and a lot of support.
And now you're program director.
And now I'm program director, and I have big shoes to fill with Dr. Murphy. Just such a legacy that she has, yeah.
So for those who may be unfamiliar, what would you say is the difference between the Doctor of Nurse Practitioner program and a nursing PhD?
Oh, so that's a great question, and that's an area that people are very confused. So our PhD or our nurse researchers are looking at primary research. So that means new phenomena or just discovery, right?
Okay.
So it's a science of discovery. The Doctor of Nursing Practice degree takes that best quality research that's already published, right, and apply that to practice to impact patient outcomes directly or indirectly. The need for the Doctor of Nursing Practice was birthed out of all this PhD work that was going on across disciplines, but then they were shelved, right? And they did not get implemented in the real world setting. And so that's the big difference. And to explain that and to guide our students through that process, because oftentimes they think, it's novel what they're doing. And then we have to guide them back to, okay, if there's not enough research in a particular area to solve a clinical problem, we hand that baton back to our PhD researchers, and we're like, this is something that needs more evidence, and so that's that partnership that we have with our PhD researchers.
I love the way you explained that to show that it's a partnership versus two completely separate things.
Right.
And how would you say our DNP program here helps prepare our nurses to be leaders in the field?
So our program, we have 10 program outcomes, and those are aligned to competencies and domains from the American Association of Colleges of Nurses. And one of those domains is just exclusively on leadership. And competencies are embedded throughout the curriculum and opportunities for our students to demonstrate leadership. And with the Doctor of Nursing Practice degree, it begins with that partnership with a clinical setting or an institution that has recognized that they need help in terms of improving patient outcomes or patient impact, right? And the student partners, and they lead the quality improvement initiative. And it's not theoretical. I mean, they're not sitting in the classroom writing papers. They're going out, they're going to board meetings, they're presenting the evidence, they're partnering, like, how can we create something feasible, cost-effective, implement it, evaluate the impact, and sustain it at this site, even beyond after they graduate. So yes, our students are the leads on their Doctor of Nursing Practice project. They also are those of our students who come who are nurse executives already.
Oh, nice.
Yes, and they are coming for their terminal degree, Doctor of Nursing Practice as nurse execs. And so they actually work with their organization to implement a quality improvement project to improve where they actually work. So, and they're already in leadership positions, they're earning their terminal degree, and it just enhances their skill set and what they bring to their organization.
So that's really cool that throughout the program, they're coming in as an executive or a leader, as you mentioned, and they're working on what I would say like a real world project to help where they currently are. That's really cool.
Right, yes.
And I also think what's really cool with y'all's program, which we don't always see with advanced degrees, that you guys have a study abroad trip.
Yes.
Can you talk about that a little bit as well?
Yes. So we have several study abroad programs across the College of Nursing. The one that's specific to the Doctor of Nursing program is one I developed, and it's a rural health focus in Scotland. And we look at advanced practice nursing, we look at health policy, and it's experiential in that the students travel to Scotland. It's a whole semester long, but they have an opportunity at first to complete modules that were created jointly with myself and faculty at Robert Gordon in Scotland. And then we go for 10 days. We're on the ground, we're visiting rural health sites, we're seeing firsthand the impact of certain health policies. And students are learning that not all size fits, not everything fits for every country, right? And so there are health policies and there are practices that are there that are helpful in that country that we could adopt some of that, but then we have to tailor practices to meet the needs here in the United States, which we have a very complex healthcare system that's very diverse. And whereas the UK is smaller, and Scotland smaller, and they have a public federal funded health system, right? That is free, even prescription, and even that there are challenges with funding and challenges with overutilization, and but they do also have a strong advanced practice nursing workforce that is population health focused. And they focus quite a bit on health promotion and prevention. So our Doctor of Nursing Practice students get to see the impact of nurses leading in public health. And it inspires them. I have these reflection videos the students complete when they get back, and they're motivated and they're ready to take on health policy here and to be more active in advocacy at the policy level for our patients across Georgia. And when they graduate, some students do go to other states. So I'm hoping that advocacy will continue in other states for our patients. Yeah.
I love that, especially just knowing that if they decide to come to Augusta University for the DNP program, they have the opportunity to not only have real world perspective for here, but they can go international to have like a very
global perspective.
Yeah.
Yes.
That's very impressive. And so earlier with Dr. Broxton, we were talking about how there's so many career paths in nursing that people may not be familiar with. And you kind of touched on this a little bit already, but for those who may have their bachelor's degree, or they might be considering, going to school for nursing with the CNL program so they can have that, what does a career path look like if you do have your DNP?
So the Doctor of Nursing Practice degree, like I said, it's applying the best quality evidence research to practice. And a student who comes into our program can choose to get their Doctor of Nursing Practice and then focus on a primary care track, like a pediatric nurse practitioner. And so they graduate, they have the knowledge and the training to sit for board certification in pediatrics. But with the Doctor of Nursing Practice, not only can they see patients, diagnosing, treating, managing, prescribing medications, all that, they also can improve the health outcomes of that patient population because they have the skill set to use the evidence to implement practice change. So they could do that, become pediatric nurse practitioners, or a family where the scope is even broader in primary care. Family nurse practitioners like myself, doctorally prepared. Or they could decide they want to function in the hospital setting with more acutely ill patients, so they can choose to become adult geriatric nurse practitioners. Or they may say, well, we want to help with the psychiatric mental health, increasing psychiatric mental health challenges that we're seeing in the United States and across the world, actually. And they could choose to be trained as a psychiatric nurse practitioner. So we have so many options. And like I had mentioned before, nurse executives, so chief nursing officers, nurse managers who are working and they have their bachelor's or a master's, they can actually look at receiving their Doctor of Nursing Practice degree at Augusta University. And there's one more option. Our nurses that have a master's level nurse practitioner education, they can return to school and within 5 or so semesters complete their Doctor of Nursing degree.
Oh, wow.
Yes. So we have so many options, and it's important to have the highest level of education available, like we have at Augusta University. We were one of the very first adopters of the Doctor of Nursing Practice degree, and exclusively only offering Doctor of Nursing Practice degree levels for the entry into nurse practitioner world. There are many programs that are still at the master's level, but the higher the nursing degree, the research has shown, the higher our degree and training, it's the better the patient outcomes. And rightly so, because we have in our degree and training, as we go higher, we are exposed to using evidence to improve outcomes. And we just start to think that way, right? And we function in that realm of evidence impacting practice. So our previous dean, Dr. Lucy Marion, she worked on the Doctor of Nursing Practice curriculum at the national level with the National Organization for Nurse Practitioner Faculties. And so, yeah, we were fortunate that we had such a pioneering dean, and she brought that to the College of Nursing.
That's really impressive. What do you think is maybe like one thing you wish more people understood about having a DNP?
The one thing I wish people would understand about having a DNP versus only being master's prepared as a nurse practitioner is that you think broader, globally. You think of not just one or two patients, but the entire community of patients that are coming. And then you go beyond that to say, to being empowered to make changes to impact the health of that community. Our organization, and some of our students are working on a statewide level with their Doctor of Nursing practice. And they're also working on a systems level within health systems. Like I had one student worked on a Doctor of Nursing Practice project in 2 different hospitals.
Oh, wow.
But it's actually one hospital system, but 2 different hospitals. So that's what the Doctor of Nursing Practice brings you. Now, the nurse practitioner portion of the training is crucial and important because there you are learning how to diagnose medical diagnosis. You are learning how to order and interpret diagnostic procedures, labs. You're also learning how to prescribe safely medications. So that's crucial. It is quite narrow focus on one patient at a time, and so having the Doctor of Nursing Practice portion and training of your degree, applying research to practice is just crucial. It's crucial, and it makes a big difference.
And I probably should ask you this earlier, but what was it for you that made you know you wanted to become an educator, not just a practitioner?
So I didn't know I wanted to become an educator. I really did not. I was going to be a midwife. Okay. That was my plan when I was in the Bachelor's of Science in Nursing program. But mentors, the dean at this particular school of nursing, Dr. Lisa Eichelberger, she reached out to me and she said, I can see a good educator in you. And at first I was like, I don't know about that. And she inspired me with her own story of very early on in her nursing career, she was given the opportunity to teach. And she quickly excelled in her leadership and teaching and became a dean very, very young. And so she told me, she said, she always wanted to give back and mentor and support the leadership potential to be an educator in a student. And so she chose me. I'm super fortunate. And that's been my career trajectory, serving, teaching in the University System of Georgia for the past 13 years.
And well, thank you for all that you do for our students, because I can see the just from our conversation, the passionate energy that you have. And I asked Dr. Broxton this, I'm going to ask you this, the same thing. If your program could just have anything, no barriers, just whatever you wanted, like the top 2 or 3 things on your wish list to help your program grow for the next cohort or group of students, what would you include? What would you have?
More educators,
Okay.
that are qualified, that are experienced. I would say we need more educators who are committed to pedagogy and who understand pedagogy, the science of teaching and learning. That's number one. And
Okay.
the second would be all the resources that we need to develop the faculty in their roles. And as you know, you probably understand teaching in an academic setting, an R2 entails teaching, practice, service, and then scholarship. And I say scholarship last because it often gets placed on the back burner. So all the things that make this role of education just supported it's a lot of resources that are needed, and for faculty to feel supported and to be able to do their job well and to advance in their role. So that's one thing. The resources, funding to help for faculty to continue to do their research, to continue to take students to study abroad.
Yes.
And to have lab space that they need to do simulation, and all these experiences that we need, all these clinical partnerships that we need for students to partner to do their quality improvement projects, right? And to have clinical experience seeing patients. So yeah, that would be second. All the resources that we need. And third, I would say all the students that we can have. And absolutely, if you have the faculty and the support, then you could take all the students, even students who are having, like, they're not the cream of the crop in terms of GPA coming in. We could take students who need a little bit more help to complete our program and to do well. Yeah. So
I love all of those things. And lastly, before I let you go, for all the students that you have now convinced to apply to get their DNP, where can they go to learn more?
So our website, augusta.edu, and if you search College of Nursing, you'll be able to see all the options, right? And I'm focused on the Doctorate of Nursing Practice program, but we have a great Bachelor's of Nursing program, wonderful clinical nurse leader program. So if you have a degree in another discipline, you can go into our master's program as a clinical nurse leader and become a registered nurse. And of course, all the options that are available for the Doctorate of Nursing Practice program, they're all there right there on our website. Yeah.
Well, thank you so much, Dr. Walters, for chatting with me. And for those watching, I hope you apply if you're interested. All right, y'all, I hope you enjoyed that episode. I certainly did enjoy talking to Dr. Broxton and Dr. Walters. Thanks to them for sharing their stories, their insights, and also about how dynamic the programs that they both lead are. So I hope you guys, if you're considering advancing your nursing journey here with us, that you stay. See if you can beat Dr. Broxton's status of being a triple jag. Let's see if we have some more triple jags out there. And let us know what you think about nursing. Has your perspective changed at all? For me, the little boy in me was always happy to hear about the cool things that happen inside of the field of nursing, but I want to know if that works for you. So let me know. And until then, I will see you guys in the next one. Go Jags!